Hello there, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. This is Thursday, February 25th. Going to give you just a few points, updates on the impact of the COVID-19 epidemic on Mobile County. Today, we are reporting on exactly 36,000 cases of COVID-19. 83 cases were added yesterday. The number of people who died with COVID is unchanged from yesterday, so we had no additional deaths added. So the cumulative number of people who've died with COVID stands at 722. The cumulative number of people hospitalized with COVID-19 stands at 4,623. It went down 5 cases, hospitalizations. So usually when you're counting cumulatively, it always adds. It doesn't normally subtract. But what happened is these data are entered daily by our area hospitals, and one of the hospitals slightly amended something that they had entered for a previous day. So that's why it appears as if the number of hospitalized has gone down. And then the number of people currently in the hospital yesterday with COVID-19 is at 90. It's less than 100 people in Mobile County hospitals with COVID-19, so that is really, really good news. So, worldwide, we're still up over 112 million cases and over 2.5 million deaths. In Alabama, we're inching up to that 500,000 case mark. We stand right now at 491,000 with just over 9,800 deaths. So I was seeing some statistics in the national news that, we added more deaths in the last 2 months than we did like the first 6 months of our outbreak. So things are moving in the right direction, and that is really good news. So please continue doing your part to protect our community by, avoiding gatherings and wearing a face covering, staying at home if you're sick, keeping your distance from others. But we still have a very serious pandemic on our hands, so we need everyone to help us continue to slow the community spread of COVID-19. And, especially since we know that we have variant COVID-19 in Alabama. The last count I heard was there were maybe 22 isolations of variant COVID, the UK variant of COVID-19 in Alabama. So we'll continue to share information about that as we learn about it. So we have a couple of vaccine events this week. Today, with the Mobile County Health Department, had a first dose vaccine event at the cruise terminal. And I think they vaccinated just over 500 people at that location today. Yeah, it looks like a little over 560. So thanks for everyone who came out today to get their first dose vaccine. And also just a big shout out to our staff that are working out there, the law enforcement and sheriff's officers and paramedics and EMTs that assist us when we're out there. And then also big thanks to the cruise terminal for your partnership in being able to offer these vaccine clinics. We have another second dose Moderna vaccine clinic tomorrow at the cruise terminal. Again, this is for people who were vaccinated at the Mobile County Health Department 28 days ago from tomorrow. So again, 9 to 2. This doesn't have the date on it, Mark, about the vaccination date. I believe it's if you were, can you get the news release that has the dates in there? Sorry, I want to make sure we get this right and we give you the right information on second dose vaccines. So let me ask Mark to get some information about that before I share it. But I will share another first dose vaccine event that we have scheduled for Saturday. And again, this is first dose Moderna that is being provided by the Mobile County Health Department in collaboration with Redemption Church on 1251 Industrial Parkway in Saraland. This is going to be February 27th, that's Saturday, from 9 a.m. to 2 p.m. And again, the eligible populations are people 65 and older, healthcare providers, other frontline healthcare personnel, first responders, people in high-risk healthcare settings like clergy that maybe offer last rites to people who are in the hospital or counseling with people who are in the hospital with COVID-19. Thank you, Mark. And also people who work in these categories. State government, correctional officers, food and agriculture, U.S. Postal, manufacturing, grocery store, public transit, education, child care, and judicial. So again, those are the folks that are eligible for first dose vaccine. We get a lot of questions about this. In fact, I got one today, someone asking if public transit workers are currently eligible, and they are not. So currently the state of Alabama is in all of phase 1A, all of phase 1B, and part of phase 1C. So the part of phase 1C that is eligible right now are people age 65 to 74. The part of 1C that people are not eligible are people 16 to 20 to 64 with underlying medical condition and additional clinical critical workers. For example, these are the folks that are not eligible right now: transportation and logistics, waste and wastewater, food service, shelter and housing, including construction, finance, like banks, that sort of thing, information technology and communication, energy, legal, media, and public safety, like engineers that might help us, keep roads and bridges safe, for that sort of thing. So those folks are still not in the current eligibility. So again, right now, it's healthcare workers, first responders, 65 and over, and then postal workers, manufacturing, grocery store, public transit, which probably would include taxi drivers and personal transportation. So that's specifically what the question was about today. So if you are a public transit worker, then you would be eligible right now. Child care, educators, judiciary, that sort of thing. So I know it's confusing, but there is a very detailed document, and anytime I get an email, people asking if they're eligible, I try to point them to this document because it's got a lot in it, and I don't always remember it verbatim. So there you go. So first dose clinics. So let's talk a little bit about second dose clinics. So tomorrow, February the 26th, at the cruise terminal is the second dose clinic for people who got their first dose at the Mobile County Health Department on January 29th at the terminal. So if you received your first dose at the cruise terminal on January 29th, then your opportunity to get your first opportunity to get your second dose is tomorrow at the cruise terminal between 9 and 2. If you got your first dose at our Sims Health Center on Wolf Road on February 2nd, your first opportunity to get your second dose is going to be at the same location, the Sims Health Center, next Tuesday, March 2nd. And remember, you have to have received first dose Moderna from Mchd, have your card, right? If you forgot it or you've lost it, be prepared to wait while we check in the electronic system. So those are the next 2 second dose clinics that we have going on. So hopefully that clears that up. If not, please go to our website at mchdcares.com. mchdcares.com. We have all of this information there. And for our offsite locations, we'll also put the maps back up so you'll be able to see how the traffic's going to be flowing. Or you can call 251-410-MCHD. All right, there were a couple other questions about the current vaccine allocation. So again, we're covering 1A, 1B, and 1C, only 65 to 74. Currently not doing energy workers or people who are 16 to 64 with underlying health conditions. That decision will be made by the state health department. And then another question that says, if a vaccinated person lives with a non-vaccinated household member who is symptomatic or tests positive, what should you do? So the guidance right now from CDC, and that's been adopted by the state health department and us, is that if you have been fully vaccinated, which means if you've gotten 2 doses and it's been at least 14 days since your second dose, if you are exposed to someone within 3 months, you don't have to quarantine. So it really depends on the timing right now. So if you were fully vaccinated and it's been 2 weeks past your second dose and someone in your household gets COVID the week later or the month later or up to 90 days later, then you would not have to quarantine. But we still recommend that you wear a face mask, socially distance when you're around this person, because the vaccines are 94 and 95% effective, not 100% effective. So there may be some what we call breakthrough infections in people who are vaccinated. So it's best to protect yourself and separate your living areas. Keep the distance for the full 10 days for your household member who tested positive, to try to continue to protect yourself from someone who's potentially carrying COVID-19 and could pass it along to others. All right, I think that's all for today. So thanks a lot for everyone again who's coming out to either complete their series this week or start their series. We're very excited to be able to contribute to vaccinating our community in this way. We'll take all the vaccine that the state will allocate to us and get it out to you as quickly as we can. So stay safe, everyone. And tomorrow, I believe this broadcast will be conducted from the cruise terminal. Dr. Chavers will give you a report from our second dose clinic tomorrow from the Mobile, Alabama cruise terminal. So I'll see you again next week. Thanks, everyone.